Meeting doctor here. Once again, talking about burnout with a focus on my Burned Out Physician book and looking at symptoms of burnout, right? And last time I talked about emotional exhaustion and the things that would happen with that. Today I want to talk about some of the cognitive, the thinking symptoms that occur with burnout. And so what this really means is that when individuals are mentally, cognitively burned out, right? They have an inability to process information as effectively as they used to. In fact, what tends to happen is that you are suboptimal in the decision making that you make, right? And so this leads to depressive mood, yes, but depressive cognitive styles, which means you're gonna blame yourself when things go wrong, and more things are gonna go wrong because you're not thinking clearly, right? When you think about this from a physician's perspective, if you aren't thinking clearly and you are in a complex decision-making environment, which patient care is oftentimes a complex decision-making environment, you're more prone to error. And so again, if we're burning out our physicians, burning out our healthcare workers, then we're going to have more mistakes in healthcare. And now we wonder why we have all these lawsuits and other frivolous things going on when it comes to healthcare. It's because maybe, at least a little bit of it, is because we have burned out physicians and healthcare workers who are unable to think as clearly or as efficiently or effectively as possible because they are burned out. Now, the other thing to keep in mind is that this is not just a healthcare or physician care issue. This is an issue that can be faced by anyone in any occupation, right? And when you're having these sorts of cognitive and then eventually physical deficiencies because you are burned out, you're more likely to make mistakes. So you fill in the blank occupation. You're not going to perform as well when you are experiencing burnout than you are when you're feeling refreshed. And so it's important to take this very seriously because, with physicians, or with a surgeon, we see the immediate consequences, right? With others, we may not see the immediate consequences, but there is a loss in productivity, a loss in return on investment, if you want to go the business speak space, right? And we need to be mindful of that and think about how do we keep people from burning out.